There are different stages of high blood pressure or this condition called hypertension. It did not just sneak up on you. I need to tell you how to react at every stage of hypertension or high blood pressure so that it doesn't sneak up on you and ruin your life. They call high blood pressure or hypertension the secret, silent killer, meaning that a lot of times you don't know what's going on in your body. You don't know the damage that's going on in your body until it's too late. But I'll tell you this, there are some warning signs. There are stages. Your blood pressure will increase in a stepwise fashion, and you need to know what to do in each level so that you can be prepared. I don't need hypertension sneaking up on you and causing you issues like kidney diseases, stroke, heart attacks. None of that is your portion because you're gonna know what to do. Now, I can't start off talking about high blood pressure without telling you what a normal blood pressure is, and that's anything under 120. You have your systolic and your diastolic. The systolic is the number on top and the diastolic is the number on the bottom, okay? And anytime you have a blood pressure where you are under 120 for the top number and under 80 for the bottom number, you're in the good. Okay, I'm talking about 119 over 79, 115 over 76, 112 over 68. These are what you call normal blood pressures. You're good. Do a little dance because you're good. You have nothing to worry about here. People a lot of times tend to think of normal blood pressure as the 120 over 82. The 131 over 86. No, because high blood pressure is not black or white, in or out. Again, like I said, there's a stage, there's like the stages, the trend. And we're gonna stop that mindset that anything under 140, anything that's not abnormal is normal, because it's not. So if you're seeing blood pressures that are under 130, you need to pay attention. Anything under 130. So we're talking about 120 to 129 systolic. And I'm gonna focus on the systolics here because I don't wanna be bouncing around from systolic to diastolic. Let's just focus on the systolic for now. But anything between 120 to 129, I call this elevated blood pressure. We are not in high blood pressure. We're not in hypertension just yet, but this is time to, tune in and figure out what's going on. You check your blood pressure, it's 124. It's 126, 127. Okay, you think you're in the green, and you are, but I would use this time to start considering lifestyle changes. I would use this time to start looking at my sodium, my potassium, my magnesium, my water intake, and my moving around. This is the perfect time to tune in on your lifestyle changes. A lot of times what we see is when you get up in age, you start having more stress, worse sleep, hormones start to go amok and all that stuff. Now we start to get into the 120s, and before you know it, you slide into the 130s, and now before you know, you're sitting with your doctor and they're looking at you talking about medications. So I think 120s, 120 to 129 is a time to open up your eyes and start considering lifestyle changes. Don't think that because you're in the 120s, you're good, because how long are you going to be good is the question. Next, stage 1 hypertension. That is 130 to 139. Now, I'm not gonna lie, I'm not gonna age myself with this, but when I was in training, stage 1 hypertension was at 140. They're putting it at 130 now, We are trying to catch high blood pressure early. We're trying to treat it early, but here's the thing. When your blood pressure falls systolic between 130 and 139, you need to be diligent. This is really a time to tune in. If I said that the time to tune in was between 120 and 129, then 130 and 139, you need to be super extra dialed in. I need you all the way in on the lifestyle changes. I need you to, again, to be focused on your water intake, your sodium, less than 1,500 a day. I need you to focus on your potassium, trying to hit that 4,700 mark for intake of potassium. I need you to get moving. I need you to get your steps and get your sleep and start paying attention to your hormones. Pay attention to your supplements. Pay attention to your foods. Are you eating a full, broad diet that's giving you everything you need? Do you have vitamin D deficiency? Can that be addressed? At 130s, do not sleep on 130s. Do not go to the doctor and let that reading be 130s. Here's what else you don't need to do. Don't go to the doctor, because when you get into the 130s, this is when your doctor is going to start telling you, I think we need to consider medications. I think we might need to start you on something. And automatically you're like, whoa, chill. Chill. How'd we get here? I was 127 last week. Now I'm 132. You want to start something? And I agree. From 130 to 127 is not a far walk. And you can probably get there with good habits. But if we stay on the slippery slope, before you know it, you'll be looking at 150. And looking like, and I'm pretty sure your doctor doesn't want to be tangoing with you if you're not serious. So 130s is where you need to get things ironed out. What happens if your doctor is saying, I want to start you on medications here? That's a very big possibility. If you're looking at 136, 138, the likelihood that your doctor is going to want to start you on at least one medication is likely. Unless you have that relationship with your doctor where they know that you're going to turn things around, they're more than likely going to suggest it at this point. And they wouldn't be wrong. Do you need a medication at this point? It depends on you. If you really think that you can turn things around and get your diet in order, get your affairs in order, get your sleep right, and correct all of the things that were causing this elevated blood pressure, then yes, absolutely, do that. Do that. It's not wrong to ask your provider or your physician for 3 more months, 6 more months. Now, I'm not saying that you need to stay at elevated blood pressures in the 150s for 3 to 6 more months, but 130s, you definitely have a chance. So you can have that conversation with your doctor, and you can buy my book and see what you can do in those 3 months to straighten out your blood pressures and get them down. But at 130s, I'm telling you, you are at stage 1 hypertension, and you are starting to enter into the danger zone to where blood pressures are having an effect on your health, and you need to act quickly. 140 to 149. Now, this blood pressure level, I don't know very many doctors who are going to play with you here. This is more than likely where a doctor is going to start a medication. It is still reversible though, because as you notice, it is a short walk from 142 to 138. It is a short walk from 138 to 132, 132 to 127. You can walk it back. With lifestyle, you can walk it back. It is not impossible. It is not hard. But at this point, at 140 to 149, you're skating on thin ice. And now your organs are starting to see some of that pressure. I don't know many docs that are going to let you go, walk out of that office, and not see you for another year while you figure it out. A lot of doctors are going to want to start you on something. Also, lifestyle changes are important here. Lifestyle changes are important at every stage, but they're drastic here. They're a big deal here. Can you put lifestyle changes over starting medications at this point? It's possible. It depends on your relationship with your physician. If you walk into the office and you're 142 and you're sure that it has something to do with your stress, maybe you drink coffee, and we're going to go over how to check blood pressure, how to know your blood pressures are correct. We're going to go over white coat hypertension and all those other things in videos. That's why I need you to subscribe. I need you to stay tuned. I need you to be updated with these videos as they come out, because it's a new channel and more information is coming. We're going to talk about that. But if you're sure that your blood pressure is elevated and it's not because of those things, your doctor may want to start you on something, and that is not unreasonable. So at this point in the 140s, you may need to consider starting a medication and also doing those lifestyle medications. I misspoke. You may want to consider starting a medication and also starting those lifestyle modifications so that you can get off of those medications. So you may need to do both concurrently, because I don't know many people who are going to let you walk out of that office with a blood pressure of 148 and put all trust in you. It might be time to call me. It might be time to hit me on the hotline and say, hey, doc, this was my blood pressure. Can we work together to get it down by my next appointment? And then I can work with you and your PCP and yada, 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 give you all the information you need. And if you can't hit me up, it might be time to buy my book for sure, but you may be started on a medication. Now, we talked about the 140s to the 149s, and you would think I would go into 150, 160, 170. I'm not going to waste your time because that's all high blood pressure. Okay, between the 150s and the 160s, we already know. No doctor is going to let you walk out of that office without treating you. You need to be treated. If you watch my other video, I talk about the damage that high blood pressure is doing to your organs. So if you're going into the clinic or into the office or a hospital for the first time and they're seeing blood pressures of 150, 160, that necessitates a blood pressure medication because we need to protect your organs while we get that pressure down. It doesn't mean you don't do lifestyle modifications. You can still do the lifestyle modifications and come off of those medications. But in the meantime, we have to protect your body. Okay? Do not pass go. Do not collect $200. You need to hightail it to your nearest emergency department, your nearest urgent care. You probably need to be started on a drip or an IV medication that's going to bring those blood pressures down into a safe level faster. Now, when I say a safe level, I don't mean to normal. I said to a safe level. You can't go from extremely high blood pressure levels to normal overnight. That's not healthy either. The level I'm talking about is a systolic of 180 over a diastolic of 120. That is what we call hypertensive crisis. Okay, once your blood pressures are above 180, this is no longer a game. I mean, it wasn't a game the whole time, but at this point, there are no games to play. There is no, we're not going to sugarcoat it. We're not going to walk around it. We are going to address it immediately. This is an emergency. This is a crisis. If you wake up and you check your blood pressures and you're at 185, 193, 201, 210, please don't sit on those blood pressures. Please don't see. You have my permission to be seen by somebody immediately. You have my permission to go straight to the emergency department. Those are not blood pressures where you just relax and try to figure it out. I say this because you can have strokes at this level. You can have kidney damage at this level. You can become confused at this level. You cannot even trust your own thoughts at this level because you can be having some confusion and stroke-like symptoms that are preventing you from thinking clearly. Okay? This needs to be addressed. At the same time, you don't want to go into seeing a doctor or a physician or a health coach. They shouldn't be dropping these blood pressures too fast either. So if you notice that they're just throwing things at you, you have the permission to ask. You have the ability to advocate for yourself and say, how low are we dropping my blood pressures? Because you have to remember that if your blood pressures have been perfusing your brain, sending blood to your brain at a certain level, your brain is probably used to that level. Although it's not good, but if you drop them too fast, your brain thinks it's having a stroke. Your brain says, where's the blood? So that can be damaging as well. So 180 and up. Yes, we can try the supplements. Yes, we can try to walk. Yes, but that comes secondary to solving the issue of why you are in a crisis. You need to see a doctor. You need to be treated emergently. You need to be started on baseline medications at that point to bring you out of the danger level, out of the level where your organs are being impaired, out of the level where your organs are being damaged, and then we can continue using those lifestyle medications. Remember, high blood pressure can be reversible depending on what caused it. And we can comb through, we can pick through and figure out what's going on. Do you have obesity? Do you have sleep apnea? Do you have hormonal changes? What's going on? Let's get to the bottom of it. Are you deficient in vitamin D? Are you deficient in magnesium? Are you eating foods that are driving your blood pressures up? We can address that. We can get to that. That's what I'm here for. That's the importance of subscribing because these videos are coming. They're coming. As soon as I shoot them, I'm putting them up. And I will have them for you because we're going to go through this together to get your blood pressures improved. My goal is to get everyone's blood pressures under control. I want everyone's blood pressures under control. And I'm pretty sure your PCPs would not mind. I'm pretty sure the doctors in the hospitals will not mind if we took high blood pressure off their plate. Can we take high blood pressure, off of your physician's plate in 2025?